Okay, why don't we go ahead and get started? Thank you everyone for being patient. I think it's just 5 after the hour. Some other people may trickle in, which is fine. Welcome to our information session for our 2 programs in the healthcare field that are both launching this fall. Our Masters of Public Administration with an option in Health Administration, and our Masters of Public Health with the focus in Community Health Education. My name is Jennifer Kalfsbeck. I am the Assistant Dean at the Seng College of Extended Learning. The programs are offered in collaboration between colleges, and I'm here to talk to you a little bit about how we offer the program, and then you'll have the opportunity to hear from the academic advisors for the program, our academic leads or chairs of the program. One of the things that I want to do is ask you all to hold your questions until the end. We are recording the event, and we have folks who are streaming in online who will also be asking questions so that we can keep the flow going well for all of the participants in varied settings. We're going to take all of the questions at the end, but we will have time for everyone's questions. So if you could just hang on till the end, we'll make sure that we get everything answered for you. You should each have 2 packets. They're very similar. They're probably almost impossible to tell the difference between until you look at them carefully. Then they follow the same pattern for each program. Many of you are interested in learning about both programs. Some of you know which program you're more interested in. They each follow the same pattern though, as I said. So page 1 gives you general information. You have contact information of the folks that are involved in the program. So you have academic contacts. You have program managers listed. So for those of you who are on the Masters in Public Administration with Health Admin option, your program manager is Alice Liu, who's here with us today. You'll have an opportunity to talk with her later about how you apply for the program. For those of you who are here for the MPH program, you'll see Jesse Nepper is listed there as the program manager. He will talk with you today as well about how you apply for the program. Oftentimes at these events, those are your 2 key people who you want to talk to when we're done so that you can figure out how to get that application in. Our applications are reviewed on a rolling basis, which means as soon as all the documents are in, they go to the academic side to make decisions. So it is definitely to your benefit to get your applications in. They are open and we have already been receiving some. So I know when we're done tonight, you're all going to run home, turn on your computers. Maybe you brought them with you today and you'll start applying right away. As soon as you do that, you'll start to hear from Alice and Jesse, but you can also reach out to any of them directly. Page 2 in both packets is the cohort schedule. It shows you when we expect all of your classes to be held online. The programs online are predominantly asynchronous with a small amount of synchronous components. What that means is most of the work that you do is structured in that it's usually certain assignments that are completed within 1 week. And then there is usually once a week a live session that you will meet. That'll vary a little bit, but the information to all of that is listed in that schedule, and it lets you know from the beginning to end what you can expect. So you can go home tonight, show your families, take it to work, and show your boss tomorrow and let them know, I'm doing the CSUN program, and this is when they own me. Otherwise, I'm free to be with you at other times. We know that we're working with busy adults, and you need to have a sense for what the commitment is like. You all know graduate school is a rigorous commitment in terms of academics. You also need to know what the scheduling is going to be like. So this is what we do to make sure that you will have that. Page 3 through 4 on both of your packets are the pages on how you apply for the program. And they mimic what you will see on the website. If you have visited it or if you do, they tell you how you can apply. Now, when you're applying for the programs, you need to go to the Seng College website. We have different application systems from the traditional students who apply through CSUN and the Seng College website. So if you're applying just to the online program, you'd go to the Seng College website and follow those instructions there. If you're not sure how to do that, before you leave, we'll make sure that you know how to get to that website. Page 5 is the tuition information for both programs. I know when many of you filled out your RSVP, you indicated, I want to know how much it costs. We always publish that in advance. It's on the website. We've printed it out here for you so that you know what the whole tuition rate will be. You know when the tuition payments will be due, and we plan all of that in advance so that you will be able to plan out that whole time period. The program is financial aid eligible. We'll talk a little bit more about that later, and we do have our financial aid officer here who can talk to you a little bit about that as well. Both programs are financial aid eligible. And that is page 6, information on financial aid, how to apply. If you've applied for financial aid before, it's the same as when you've applied in the past through the FAFSA. You don't have to wait until you're admitted to apply for financial aid. In fact, oftentimes it's a good idea to go ahead and apply in advance. I already said that part. Welcome. So why would you want to come to CSUN? Some of you I know are already CSUN students about to graduate or expecting to graduate maybe in a year, and you're checking it out maybe for next year, or you've been here before. Others of you are new. One of the things that you will have the opportunity to learn from Lou Rubino and Sloan Burke is information about the distinguished faculty that teach. The good news is with this program, it's an online program. It's offered through extended learning, but we draw from the same faculty pool as those who take the residential or face-to-face program. It's offered out of the colleges of Health and Human Development. We also partner with Social and Behavioral Sciences. And so all of your faculty will come from the traditional departments and the traditional colleges. And your degree will be from CSUN. The degree in the Master's in Public Administration with an option in Health Administration will be, if you do the full Master's, will come out of the Social and Behavioral Sciences College. And you also earn a graduate certificate in Health Administration out of the College of Health and Human Development. If you do the MPH program, it'll be the degree in Master's in Public Health out of the College in Health and Human Development. The reason that I'm saying all of this is because people wonder when the College of Extended Learning is offering it and when it's online, is it still a CSUN degree? It's exactly the same curriculum. It's the same faculty. The good news is a lot of the faculty that are incorporated are also practitioners in the field. So they know that you've come here to learn how to do that work and how to work in the field while you're a student and when you leave. So we have the opportunity, because we offer these programs, to extend the reach of the university to also include qualified practitioners who are on that faculty. Both programs are long-standing programs. The MPA has been around for over 30 years, and the Health Administration, or the Public Health program has been around for over 50 years with its accreditation for over 40. You'll learn more about that from Sloan Burke. The Health Administration is a new option in the MPA, and Lou will talk to you a little bit about why we know that it's critical to focus your MPA in the area of health administration. It's a collaboration between the three colleges that I mentioned, primarily Health and Human Development, Social and Behavioral Sciences, and then of course the Sang College of Extended Learning. Our goal is to extend the reach of the university really to non-traditional students, to mid-career adults, to busy adults. Most of our students have families. They're working one job, sometimes two jobs. Sometimes they're caring for aging parents. All of the above, and they need programs that will work well for them. So we have face-to-face programs that offer evening and weekend classes, and more, as you can imagine, we're offering fully online programs so that you can have a life and go to school and achieve your goals. And we work very closely with faculty to help them devise schedules like those that you see in front of you that work well for mid-career adults. So you'll see that in most of your semesters, you will only be taking one class at a time. A lot of them are 8-week classes, so they're intensive, but you only have to worry about what one instructor is expecting from you during those semesters so that you can really stay focused on those topic areas rather than having overlapping classes. In the instances with MPH, the public health program, in which there's more than one class at a time, that's been done in cases in which we knew that you needed more time with the content area like biostatistics. So our focus really is on making sure that we cater to everyone who's not a traditional student. Really, the non-traditionals have become the traditional today. So we like to think of ourselves as your red carpet to the CSUN degree. If you've been a student here before, you're used to registering for your classes yourself, waiting for the opportunity to register here. Your program manager will register you every semester. You won't do any of that. When you need to find out what the syllabus is, what the book list is, you will learn all of that from the staff that are working with you. The goal is so that you can focus on your studies, focus on your academics, and we're going to communicate and work closely with you on everything else. Okay, I'm going to hand this over first to Lou Rubino, our academic lead for the Health Administration program.
Thank you, Jennifer. Welcome to our on-site audience as well as our webinar audience. I'm Dr. Lou Rubino, and I am the program director and the lead for the MPA Health Administration Certificate program. It's very historic times. I tell my students this, and it's like never before in my lifetime that we are experiencing such a really dynamic and important change that's happening in our country in regards to healthcare. It's very exciting, but it's also going to offer a lot of opportunities to students like yourself. We are looking at the Obamacare right now and seeing some of the results, whether you're getting your news on the internet or on TV, or if you're a dinosaur like myself and looking at the morning paper, you can't neglect seeing something about Obamacare. And it's a good thing for our country. It really is going to allow a lot more people to have insurance and the eligibility in order to get the health care that they and their families need. With Obamacare, it really is a paradigm shift for our nation, and it is a new reality. Affordable Care Act will provide a lot more necessity for jobs, for a lot more administrators and people that are working in order to provide people the coverage they need and to oversee the care that's being provided. So as we look at the U.S. healthcare delivery and this program that we're offering you, we see this as the availability of you to be able to get the information and the knowledge that you need in order to be successful in the healthcare field. It's something that is not just centered upon the United States, though. I do my research in China on healthcare reform, and it's very similar what they're trying to do than we're trying to do. And if you travel anywhere, you'll see that healthcare costs have gone up so much that the governments need to do something in order to try to provide more and better care to the people. So the globalization has provided this opportunity to look at healthcare and what we can do to improve our delivery system throughout the world. And this program will be also able to apply the principles that we see here at the United States, but also in other settings. So it's an exciting time with the globalization and what's happening in order to get you the information that you can obtain in our degree and certificate program and apply it in a variety of different places. We also are experiencing, as well as the rest of the world, an aging population. We baby boomers, are going to need more and more health care as we're aging. We're living longer because of the fact that we do have medicine and treatments and new innovative ways to keep us healthy. And this is going to offer us and more people to needing health care more employment. And so we are experiencing in the United States an increase in our aging population, but that also correlates with more healthcare work and applications. So the jobs are going to follow the aging population. Today, also, leadership positions, you really do need a graduate education. Even probably 10 years ago, it wasn't the same as it is today. It's a wonderful thing that more people have gotten bachelor's degrees, but I've been teaching here now for 15 years. I used to be a hospital administrator my prior 20 years to this, and I've seen many, many changes in our industry. Used to be that my students wanted to all be hospital administrators, but that's not the case now. Now we have lots more opportunities and lots more available sites that I'll talk about a little bit later as to where you could work. But this idea that leadership and what we need in understanding how to manage and supervise employees is essential for people to be able to climb up that ladder in their organizations. And these programs will allow you to do that. So it's a very exciting times for us, but also exciting times for all of you in order to look at your future and see if this is not only the program's a good fit for you, but also a career in health administration is a good place for you to go for your future. So now I'm going to turn over to Dr. Sloan Burke.
Thank you, Dr. Rubino. Hello, everyone. Thanks again for attending tonight and this webinar. Well, everybody, are we ready to grow? It is growth, growth, growth. It is exciting times, you guys, for both of these careers in health administration and public health. We are seeing amazing statistics. When we look at healthcare administration, the outlook is a 22% projected growth rate over this 10-year period from 2010 to 2020. That is incredible, you guys. When you look at the average growth rate for other occupations being about 5 to 10%, good, still stable in a thriving economy, but in this area, when we're looking at 22% to 25% growth patterns, it's absolutely incredible. And that's what we, right? When we get degrees, when we get certifications, we want to look at, okay, Where are the jobs? Are they really here? And we have the statistics to prove that, which are exciting. And public health, the employment outlook is right there with health administration at 21% projected growth rate over the next 10 years. And what's even more exciting about this, when we've looked at the statistics over just the last 5 years, we see a 29 to 30% growth rate in the jobs being secured in public health and health administration. So just as Dr. Rubino had talked about the growth and our political growth as we have healthcare reform, which public health is tied right with that, we see tremendous growth and opportunity in these areas, which is fantastic. So across the board with the healthcare industry, which incorporates public health, we have a lot of public health educators working now at hospitals, and obviously one of the pillars of public health is health administration, so both of these programs are very integrated. But when we look at the healthcare industry, it will generate 5.6 million new jobs by 2020. Sounds good, right? There's going to be places to apply. That is key, right? That is the key. So the demand for healthcare and public health both is soaring in the U.S., as we talked about, double the rate of the national economy over the next 8 years, which is exciting because as we look at the economic growth and it's now strengthened, we're out of the recession in terms of in the U.S., so we have a stronger economy and we have more of a focus on prevention and both health care for the needs of the sick, but also on the prevention side. You know, as we see with Michelle Obama's Let's Move campaign, we are focused on prevention and wellness in this country across the board. It isn't about, treating the sick entirely, but it's also about prevention programs and keeping people healthy, keeping people living longer. And we need jobs in response to that and in both industries. So pretty exciting. And these aren't, you always like statistics, where did they come from? This is the U.S. Bureau of Labor Statistics in 2013, and we've been following this with various data, and it's very exciting. And we find that too in public health. There's a 70%, 80% recognition of what public health and those in health administration do. It used to be 10, 15 years ago back in the old day, when I got my degree in public health from here at CSUN in the 90s, we'd say, health education, public health, what do? You sit in a classroom, I don't even know what you do. Or you only can work at a health department. That's the only place you can work at. And in fact, that's not the reality. There's now 80% of employers in the public health and health administration fields recognize what a public health educator does, what a health administrator does, and knows exactly the need for that. So it's pretty exciting times. Okay, I hand it back to Dr. Rubino.
Thank you, Dr. Sloan. We're offering you a very unique program with the MPA, Masters in Public Administration, with the Health Administration Certificate. It's the best of both worlds. It doubles your opportunities. Because I have an MPA, it offers you the opportunity to learn about management and administration that could be applied really to any setting. The Health Administration Certificate that's linked to it gives you that special application for the healthcare industry, of course. The MPA, you might think, why public? And does that mean just a government job? And it doesn't mean that at all. The MPA degree, even though it's Masters in Public Administration, it really does apply to all settings in healthcare. This graduate certificate gives you the special application that you need, but the MPA gives you the structure of the administrative processes and theories. The program provides these managerial competencies for government and not-for-profit type of positions and places, but we end up in healthcare having to have the knowledge and skills of understanding the intergovernmental types of relationships, because whether we're a private hospital or a medical group or a nursing home or any other kind of healthcare type of business, we end up dealing with the government. That's a big payer for our patients. It's somebody that we will, under Obamacare, get even more involved with government. And so that's why this special Masters in Public Administration combination is so important. And it's really set for the future, which is now here in the United States. So it's very exciting times that you can not only learn the managerial competencies that come from the MPA, but then get the special application for healthcare and leadership and administrative positions. So here are some learning objectives, what you can do with your health administration focused MPA. Apply the advanced knowledge and skills for successful health administration practice. So it's the skills and knowledge that you need to go out there and do it. A lot of it is giving you confidence because you've learned these things in class, and then you apply it onto the job, and it'll give you what you need in order to be successful. You can lead contemporary public sector and healthcare industry units and organizations with this focused MPA. And you can apply the management and the healthcare administration theory to the professional practice of health administration. So it's a combination of the two that really provides you what you need to be successful. You'll engage in thoughtful and ethical professional practice as a leader in the healthcare industry, always very important. We believe our healthcare industry, attracts a special type of person, one who wants to help people. You don't have to be a clinician. You're still helping people by working in healthcare. And this idea that ethical treatment of people and patients, as well as applying to professionals, your employees, your doctors, it's a very big part of our program to make sure that you understand the professionalization and what's really important to be successful in our field. You engage in current and relevant policy creation and implementation through this program. So much new policy has been developed through Obamacare, but it's going to continue. It's not something that just happens once. Obamacare is being phased in over several years. And so you're going to see different policy changes, and you're going to be seeing some tweaking of policies depending on who gets elected next year, or the prospect of changes that could be occurring in the industry are still there. But we're going to give you the knowledge that you need in order to navigate through those waters no matter what's happening. Apply cooperative and collaborative practices across units and organizations. You can't work in a silo any longer. We in healthcare understand this. Teams are so very important, interdisciplinary teams. More than, when I was in school or when I was practicing as a hospital administrator, all different types of people have to come together with different specialty in order to do what's best for the patient. And it provides the administrator and the administrators that we need this opportunity to collaborate, to bring groups together in order to have team building and to get the most out of these teams, that people can use the synergy that's created by working in groups in order to perform better, in order to increase your organizational abilities to be successful. So our program will allow you to understand how these types of cooperative and collaborative practices come into play, and what you can do as a healthcare leader in order to be supportive of that. And to manage today's diverse and expanding public sector and healthcare industry workforce. Those of us that are in Los Angeles know the diversity here, but we're just the beginning of the nation, increasing in diversity throughout the rest of the nation. As I said before, through globalization, it's really the ability for us to work with all types of people. And our program will allow you this opportunity to explore how you can be more successful in dealing with a diverse workforce, but also a diverse patient population. Cultural competency is one of the skills that we will provide you in order to really make sure that you're doing what's best for the patient, depending on what their particular background is, so that you can excel at what we're doing, be basically very patient focused and centered, so that depending on where they're coming from, their background, their heritage, their religious orientation, we're going to be seeking out the healthcare treatments and medicines and provision of support that's going to match what they need for their culture. So our program is not just for a setting in one particular area that might have a population that's very homogeneous. It's to expand out to a great number of different people of different types. And this program, I think, is a good program in order to allow us to give you those kind of tools and techniques to be successful. I'm going to turn it back over to Dr. Burke now.
Thank you, Dr. Rubino. Excellent. So what can I do with my Master's in Public Health, the MPH? Well, a lot of us can think back to times when you had that aha moment about your sort of career goals and what you wanted to do in the future. And a lot of times when you reflect back, it's probably when you were pretty young. You know, for me, I lost my favorite aunt, who was very near and dear to me, to breast cancer when I was 12. And even before then, I had always been intrigued by medicine from a very young age. And so I had that interest, and I actually applied to medical school in the Caribbean. That's a whole other story that I'll have to tell you someday. But you can think back to that moment where you were touched by either a family member's health issue, your own health issue, others, or it may have been you started out thinking, yeah, I'd like to be a doctor or a nurse. But then, you know, we call it sometimes, you know, we kind of laugh because in public health, nobody says when they're 6 years old or 8 years old, I want to grow up to be a public health educator and public health, you know, not like a firefighter or an astronaut or something, right? You kind of discover it. But then when you do and you realize it's so focused on prevention and touching people's lives, keeping the focus on, as I said before, people living longer, living healthier, and practicing lifestyle habits that will hopefully keep them healthy and alive and disease-free forever, it becomes very exciting, right? And you can think back to that time, well, yeah, I remember when I first became intrigued in either allied health or medicine. And so what can you do with this degree? What do you actually do with it? And when we look at it versus an undergrad degree in public health, health education, that places you in a more coordinator role or more support role. But a master's in public health, get ready, because if you like to direct personnel, direct budgets, programs, grants and things, you're in the right area. So we will teach you with this program how to create, direct, and advocate for approaches, again, as I talked about before, that are focused on prevention, which is exciting. Many of our graduates go on to work in state public health departments, local health departments, national, the Centers for Disease Control. We've had interns go to the World Health Organization, and we'll talk more about that later. But again, focused on prevention and wellness. Conducting needs assessments, well, that kind of sounds a little dry, right? You're like, what? Anything involving a survey? But no, it's very exciting. There's so many innovative needs assessment techniques, like utilizing photo voice, taking pictures, taking audio records of people's experiences, and really getting into the qualitative and quantitative of what people experience in terms of their health and disease outcomes. Implementing and evaluating health-based programs. You will learn how to implement programs for positive behavior change. And they might be knowledge programs, they might be behavior programs, they might be refocusing somebody's attitude towards a more positive outlook on wellness. And it might be, you know, looking at worksite wellness programs. You might be at a corporation where you're focused on prevention, or it might be they're actually out in the community in a grant-funded program. We have faith-based organizations now involved, community-based organizations. So you're implementing and evaluating, learning those skills on how to really evaluate those programs for their quality that they are. And then creating relevant communication materials. And this gets fun, guys, I'm telling you. Creating health education materials, and now it involves so much of social media, which you guys could teach me a thing or two. But looking at Facebook and Twitter, we're finding so many innovative ways to reach out to people, texting, in terms of delivering health education content. But you'll learn ways on how to create communication materials that are specific, that really reach people, that speak to people, whether it's a brochure in a doctor's office or if it's something, it's an actual website. You'd be learning how to create health-based communication materials, which is so important for what we do. And how to lead and execute programs, personnel, and budgets. There's the teams I talked about. And how do you really manage budgets effectively? How do you really manage personnel effectively? You'll be doing that in terms of funded grants out in the real world and working in public health departments, working as a part of either, if it's very programs-based or personnel-based, you need to have these skills that are essential, because as I said before, we're prepping you to be at that sort of director level when you go in. And applied epidemiological principles. We love that word, right? It's like the $500 word, epidemiology. How many syllables does it have? Okay, it's great. But that is the study of disease, mortality, morbidity, and those are fancy words of looking at disease trends or, you know, actually causes of death trends. But why are they impacting certain areas and communities more than others? It's fascinating, and you can do detective works. When we look at food outbreaks, for example, you know, food poisoning outbreaks in a certain location, we start to look at some of these numbers and epidemiological analysis for both chronic and infectious diseases. It's pretty exciting. And applying the theory, again, as Dr. Rubino had talked about, theory gives you the foundation. We don't become too theoretical in this program because we have it very practitioner-based. We want you to hit the ground running, and a lot of you already are in the ground running. You may be working in public health departments or had a very dynamic internship where you've already been working out in the field in public health. So we want to make that and look at sort of the advanced contemporary model evidence-based programs. What's out there already and what's working? What does the NIH use, National Institutes of Health? What does the CDC use? And what does the American Heart Association use? And how can we incorporate that for our own program and make it successful? Okay, we are celebrating over 40 years of public health accreditation, which is exciting, you guys. We've been accredited since 1971. Whenever you're in a program in public health, if it's not accredited through CEF, the Council on Education for Public Health, this is not a program you want to choose. CEF upholds the highest standards in public health and ensures our programs, our learner outcomes are in alignment, all of our course materials, our syllabi, every experience that you receive as part of the classroom or the course is certified and is worthy and speaks to competencies for public health professionals. So it's key. Our program, as Jennifer had says, has been around for 50 years. So it's exciting time. So we wouldn't have gotten this far, this many decades, without having a solid, reputable program, which you'll be a part of. It's just exciting. All right, I hand it back to Dr. Rubino.
Thank you, Dr. Burke. We've been talking about the program and as a curriculum and a course of study for you, but what happens after that? We have opportunities for jobs that are going to be opening up for you that will allow you the opportunity to work in different types of healthcare settings, but jobs that might be high-level jobs or mid-level jobs. Technical assistance. Did we shut it off? There we go. Yeah, no, I know what's happening. Okay, thank you. Sorry. Nope. Go back one. Thank you. So the different types of settings and the different types of jobs that you might be able to apply for or to lead yourself into if you're already working at a place of employment, might be looking for your personal development and professional growth. Administrators, program directors, program coordinators, project managers, senior directors, supervisors. These are all managerial types of jobs that are going to be there, that have to be there. We always need people supervising other people. And with all these changes in healthcare, there's going to be more healthcare workers, thank you, and there's going to be more healthcare supervisors and managers. So, some of these. Want to try? Yes. So, yeah, the different types of jobs that you might be able to have are up there and the different sites that we might be able to work out. Here we go. So, customer relations coordinator, division lead, office manager, because these titles are appropriate for lots of different healthcare sites. It's not just a hospital anymore. It's a lot of other different places. Next slide, please. Who took it? So we work in hospitals and public health agencies, in medical groups, clinics, and outpatient settings. That in particular is a big growth area right now. Lots of doctors types offices coming together with more of an interdisciplinary team, hiring people that are healthcare administrators, public health workers in order to provide better care for their patients, more coordinated type of care. But lots of other offshoots to the diversification of our healthcare industry away from hospitals into other settings like surgical centers, imaging centers. These are all opportunities for people with the MPA and the Health Administration Certificate to work at. Home health agencies, hospices, these are part of the long-term care industry. With the growing senior population, there's going to be many, many jobs and many people that need supervision at these different types of sites. But health insurance companies, sometimes you don't think about that. You think about going to work for a place that is actually treating patients. Well, health administrators are at these other type of sites that don't necessarily have patients coming to them, but they do somehow are involved in the delivery of health care. So insurance companies will need the MPA with the Health Administration Certificate in order to have eligibility workers, provider relations representatives, people that are supervising, the people that are getting the contracts with the government, with the doctors, with the hospitals, many, many different types of jobs associated in the health insurance industry. And then all these government offices that are now dealing with Obamacare and getting the insurance exchanges, getting people onto getting them coverage that they need, even the government offices for Medicare eligibility, Medicaid eligibility, those are healthcare administrators that work there and that supervise the workers also. So we want you to think about this as a opportunity to get a degree that you have a chance to work at many different types of sites that are involved in the healthcare delivery of the patient. So we think that the combination of the MPA with the Health Administration Certificate will open those doors for you. But if you're already working in the industry, we'll provide you that advancement that you might need, the recognition and the increased knowledge and skills that will help you in order to be promoted or to go to a different site or different placement at a higher level. So it's an exciting time for people in the industry but are not in the industry to come into our program and to get involved. So I'm going to turn it back over now.
Thank you, Dr. Rubino. Excellent. Thank you. All right. Okay. This is my next slide, right? All right. Job titles in public health, and I included also show me the money, right? That's it, right? Little Jerry Maguire, old school reference there. But it gets exciting too, as Dr. Rubino mentioned. These are the different areas you can work in public health, and really the list is even so much more vast than this. But this is actually provided by our Association for Schools of Public Health and the general categories. When you look to the left in terms of salary, that's usually actually undergraduate degrees, and so entry level, what we call it. And when you look to the salaries to the right, beyond even just the graduate degree, the MPH degree, but usually that involves a little bit of some years of experience in these various fields. So you see Health Services Administration. This is tied in to Dr. Rubino's program, and the MPA, when you think about administering programs. Biostatistics, if you crunch the numbers, you're there in the different areas. Epidemiology, and then when you look at health education, behavioral science type of employment, if you're working maybe at a health-based nonprofit, and you're focused on health education, you might still have a team, and that's 33,000 to 86,000. You can kind of get a snapshot of different areas. Environmental health, that is not our area, but it's still a competency that you're going to learn as part of our program. You'll take an environmental health course, which is really fascinating as well, area of public health. International health, you can kind of see the differences there. Maybe you have a desire to travel or work in another country. You've always been passionate about global health or making change in your home country. This gives you the opportunity to do that in that area. And where we see nutrition, working at nutrition-based, or it might be a community-based program that their mission is to serve nutrition, education, and awareness programs. And then you can see like public health practice or program management. That's where you're administering different programs, as we had spoke of, and the salary range there. And what I love, though, too, when you look at the salary ranges on the right, you think, okay, these tend to be those with a graduate degree and some years of experience. But don't feel too deflated, because it's not that, this is outside the norm of 30 years, because this is an average. And when you think of Los Angeles, right, we have a higher cost of living here, and the good news is higher salaries. So we're actually more towards, don't look the complete to the left, we're over towards that mid-range, even in entry level. Many of our graduate students from the MPH, when they graduate, I know of a few that right off the bat they were making $65,000 to $70,000 right here in the local Los Angeles area. So the notion that, hey, public health doesn't pay, there's no money in public health, and no way, we're right up there, okay, with other programs, which is really exciting. Okay, they're telling me I need to move on. I can't show you the money anymore. Places you may work with a degree in public health. This is just a snapshot, and I had mentioned some of these agencies, again, both state and national agencies, you know, very prestigious. You may be passionate about a certain cause. I worked for a breast cancer organization for 10 years before I came to academia. So, and I also worked for a health insurance company for 5 years before I came to academia. So you just never know where your future may hold. But that's what's exciting. Some people like to work in public health departments because they're not focused maybe on one health issue. After 10 years of breast cancer, even though I was very passionate about it, I was like, okay, it's time to move on to a different disease or health issue. So you get a little bit of that. And we have extraordinary internship partners, too, in our program for those local, but also for those who are out there nationally. We have many partners out in the community, and we'll help you with that in terms of part of the field practical experience. So exciting organizations to be a part of and to make that change. I hand it back over to Dr. Rubino or to Dr. Jennifer Kausbeck.
Thank you. So are you ready to apply? I know I want to go back to school now after listening to both those presentations. The little freaked out about the excitement over food outbreaks. Yes. You were really excited about food outbreaks, but great. Okay, so you can apply now. Some people, as I mentioned, have already started their applications. Some have completed their applications. Some apps have been reviewed by our academic committees and have been admitted into the program. So you can go home today when you're done and start applying to the programs. As I mentioned, they're being reviewed and accepted on a rolling basis. So once we have all of the items that are required, each program is a little bit different. That's why we have 2 packets for you. So you'll want to look to see what those application requirements are. When we have all those items, they go directly to the academic team and they review your applications as they come in. Apply online for both of them. They're separate applications, so for those of you who still aren't sure, you'd have to apply separately. You won't apply to one and have the opportunity to switch it over to another one, though I'm guessing after hearing what both of our presenters have mentioned, you can tell which area is more for you. A lot of times we learn from folks who call in or send emails, I'm not sure which discipline or field or profession's right for me, but now we've sort of learned how very different they are from one another, even though they're both in healthcare. So you probably now know which area is more leaning in your area of interest. So of course you need to have a bachelor's degree in both programs. It can be in any discipline. If you have a 3.0 GPA, you will not, cumulative, you will not have to take the GRE. If your cumulative GPA is between 2.5 and 2.99, you would have to take the GRE. There's more information about that on the website, but that's typically a question that people ask. They want to know, do I have to take that GRE? And as we are mid-career adults, as we get older, we just don't do as well. We're not as excited about those standardized tests. So I like to make sure you know right off the bat, for many of you, you may not have to take the GRE. The costs for the programs are listed here as well, and you have them in your packets. So the MPA with the Health Administration program is a 2-year program. It's 36 units, and it's just a little more than $26,000 total. You can see in your packet how it's broken up into those 6 different payments. The Master's in Public Health is 46 units. So it's a little over $31,000 total. It's a little bit, not quite a 2.5-year program, but a little bit over a 2-year program, and includes a practica and some labs for the biostatistics courses. So accounting for the differential there, and of course 10 more units. Your handouts have all the information about how to apply, as I've mentioned before, information on financial aid, the application process. The big question then was, well, who do we have them contact if when they leave, they want to remember one name, and we've introduced you to several. So I decided, because my email is so easy to remember, if you leave, you lose all your paperwork, you're not sure how to find the website. If you send an email to jennifer@csun.edu, you'll all remember that. Just Jennifer, like Cher or Madonna. It's just Jennifer. I will respond to your email. I will make sure that the questions that you have and the answers that you need will be answered. The questions that you have will go to the right people. Or you can refer to your documents if you want someone other than just Jennifer. Okay, now we're going to open up for questions from the audience. So I'll invite Dr. Rubino and Dr. Burke to come up. Why don't we bring the second microphone too so we can share. and we will be open for questions about the program, how to apply, academic questions, nature of the programs. There we go, right in the front. Go ahead.
I was under the impression that the MPH program was. Oh, hello. Sorry, you
You're going to
scared
have
me. I was like,
microphones too.
ah. Oh, do I have to hold it? Oh, okay. I was under the impression that the MPH program was either online or campus. On campus?
Correct.
Okay.
There is a please repeat question.
Oh,
Okay.
For our online audience, we're going to repeat the questions.
okay. I was under the impression that there was.
You're going to repeat the question.
Okay. The online, the MPH is offered face-to-face and the new online option. So both.
Okay. Do you guys already have like a mapped out plan of what the cohort is going to be, or?
We do. We already have a plan of what the online program is going to be and cohort. So when you click on the information on the website, on SANG's website, it shows you each course that'll be offered and which term.
But even for on campus, because that's
For
like what I'm more
on-campus,
interested in.
There's a little bit more flexibility in the on-campus program.
Okay.
So,
And
yeah,
is
in
that
terms of
there's a like a list of the
there is.
classes?
If you just click on MPH program on CSUN's main website,
Okay.
it will lead you to the face-to-face
Okay, because the other times that I've looked, I've only seen the online. Okay.
Interesting. It's there.
Okay. I have
It's
to
there.
dig a little deeper, I guess.
Okay, let me know if you need help.
Okay.
Okay.
Other questions? Oh, there's a question from our online audience.
I found that my BS in public health education is irrelevant in the job market. Hospitals require RN licensure. How will the master's program affect this dilemma?
So the question was that the bachelor's degree at the public health level hasn't been helpful in work, and they are wondering, again, can you repeat the last part?
How will the master's program affect this dilemma?
How will the master's program affect that dilemma?
Okay. No, that's a great question. In terms of undergrad, our undergrad job placement rate is eventually at 90%. So our undergrads find employment. It could be just finding that perfect fit. There can be a lot of competition sometimes. The distinguishing piece with the MPH program is it makes you even more competitive. And you have that Master's of Public Health, and that will differentiate you from the candidates. In some job applications, you know, you're up against many candidates, as we know. You want to distinguish yourself and set yourself apart. And the MPH does that, as well as your certification in health education, all of those things. But when we look at the MPH, that will make you stellar among other candidates. Thank you.
Other questions? Oh, there we have one at the middle table and a microphone finding its way to you.
Thank you. What's the difference between the Master's in Public Administration with the Health Administration option and the CSUN Master of Science in Health Administration?
Okay, so the question is, what's the difference between the Master's in Public Administration with the Health Administration option and the Master's in Health Administration?
The MPA with the Health Administration Certificate and the Master of Science in Health Administration are both graduate degree programs. This one's online totally. The other one that you've mentioned, that it's on our campus, is a traditional program, so you would have to come to campus, come to classes. So that's a big difference for a lot of people, obviously. It still is going to be a master's degree program that you could use the same way, that you could use as a supervisor or manager, as administrator of all those different sites that I talked about. This particular program is more public administration emphasis, and so there's going to be more in the classes in regards to the interface with the government and the policy issues that are very important today. Whereas the other types of programs that not only at CSUN but other traditional type programs might be more operational, that won't be as much emphasis on public administration. So you really do have to look at the particular classes, and that's what I would direct you to do if you're trying to compare programs, whether it's our online program here, a traditional program at this university or other universities, and you'll get a feel for their difference by looking at even just the catalog descriptions of the courses and the classes. It's a good way also if you're divided as to your interest in our two programs. If you look at the classes, I think usually students can get a better feel for what they'll be studying and what they might be more interested in and more passionate about.
I would add to that too, with the MPA plus the health admin, you're earning your MPA and you're earning the graduate certificate in health administration. So right now we have folks who earn just their MPA with a focus in management and leadership, so it's advanced classes in that area, but they have an MPA. If you graduate from this program, you could apply for jobs that look for an MPA and apply for jobs in the healthcare field, so you have both opportunities available to you. Other questions? We have one right over here in the corner, the microphone. Microwave, I'm hungry for dinner. Microphone finding its way over. Go ahead.
Okay, I have two questions. The first one is, as far as the online classes, is there a certain time you have to be online in order to complete them, or is it at your leisure?
So most of it, as I mentioned, repeat the question, thank you. So the question was, are there certain times that you have to be online for the online classes? So most of it is asynchronous, meaning you're doing things for the most part on your own schedule. Having said that, weekly there are assignments that are due, and the expectation is you will submit them when they're due. So if something is due on a Wednesday, you might be a morning person doing it at 5 o'clock in the morning before everyone else wakes up, or you may be one of those night owls. Maybe you put your kids to bed first, and then you've got your little pajamas and bunny slippers on, and you like to do your work then. You'll be able to do that at midnight instead. There will be once a week synchronous sessions, which are webinar-like. So if you've participated in a webinar or kind of like a Skype session with several people attending it, there will be those once a week, and they're for approximately 1 hour. Usually they don't go beyond 2 hours, and they will be on within the same range. You'll know in advance what day of the week they will be. If for some reason you can't attend a session, you will have an opportunity to do an alternative assignment. So you won't be held to those if you have to work or you have something that's going on. So it's structured, but it's also on your own schedule. It's a bit of both. Does that answer the question?
Yeah.
Okay,
yeah.
good.
My second question is there a price difference in completing the MPH online as opposed to doing it on campus?
Yes, I'll let Dr. Burke speak to that because you probably know your other rates better.
Okay. The question was, is there a difference between the cost of the MPH in-state, face-to-face, and the MPH online through saying, and you saw the rates for the MPH online, and roughly it depends. I mean, when you look at the information through graduate studies, you know sort of the tuition rates, but I think it's roughly, it'll end up costing about $24,000 on average, correct? For about, 2-year program. So you can kind of see the difference between that. That depends. Now they average in your other costs beyond just tuition, that you'll need, such as books. They anticipate a certain level of housing, transportation costs, and things like that. But I think if it's straight tuition, it's 18 to 19,000. Is that right? I don't know. I mean, it varies. The general area that they say is 6,000 a semester,
and that's
so it depends on how
campus.
fast.
On campus.
Okay.
Correct. So 6,000 a semester on campus. So if you were looking at it is then the 12. It's 24,000. Yeah, the first time.
Great. Thank you.
Yes, and Lou, Dr. Rubino also has a comment.
My experience also has been what's good about the online program is you're going to be with a group of cohorted students, and you're going to be going through a very set schedule so that you're going to graduate on time. You're going to know when you're going to graduate. A lot of people that come in a traditional program, it's not a cohort, and at least our program isn't, yours is not. And so for whatever reason, life gets in the way or whatever, and they say, oh, I'll take off one class now, I'll do that later. You have to pay lots of additional fees. You're not just paying for the classes and books, you're also paying for a lot of the university fees that are associated with that, and so that brings the total up more comparable even as you go longer into the degree program.
One more point too, that some of our face-to-face students struggle with, and obviously you have an interest in online, and that's why you're here today, but with the scheduling piece, as Dr. Jennifer mentioned, having the commuting piece, a lot of our courses are offered 4 to 7, 7 to 10 to accommodate the working adult. However, when you think of transportation, we have students that come from all the way as far as Long Beach, and You know, they have commented, oh, I wish you had an online program when I was sort of trying to commute here is a big factor, and it can be. So, I mean, face-to-face will always serve its purpose. It's fantastic. It's not that, but this is such a great option as well for those that have commuting issues, family obligations, and other obligations, as we talked about before.
Right. You will notice that with the tuition for the residential programs, that there are additional fees that are added. The only additional pieces that will come with this are your books and resources. We won't add a fee for a new service. You won't get an email that says, oh, tuition's going up next year, get ready by X%. So you have this rate. So a lot of times what we find out is that students start out in residential programs that are akin to the programs that we're offering through self-support. And if they're not able to finish relatively quickly, they find that it ends up being the same cost or even more expensive, because if they're only taking 3 units a semester, they're still paying a larger amount. So if you know that you can take 9 consecutively and you're not concerned about getting into your classes and you're able to do the commute, then it may be more appropriate for you to do the face-to-face version. For a lot of people, that really isn't an option. It ends up being sort of a wash or even more economical to do the online. And only you will be able to figure that out for yourself. But it's a good, important question. And that's why we publish everything, so that you know exactly what it will cost and what to expect. Other questions? Online again?
Yes, we have an online question. The user asks, which of these programs would be best for someone in clinical research that is looking to grow in the field?
Yes. Which?
Please repeat the question.
Please repeat the question, yes. Which of these programs would be best for somebody who is currently in, I got it, clinical research? Thank you, Dr. Rubino. He's questioning. I was stumbling there in the beginning, but I visioned them there in the clinic. You're there, you're with us. Public health would definitely be the best fit with the master's in public health. We actually have graduate students in our MPH program that work at research centers and research institutions currently, and their MPH will broaden that even deeper and further in terms of that clinical setting, or also be a good preparatory for a doctoral program in public health that will be recognized and valued in a university and clinical setting, which is very important and highly recognized nationally and prestigious. So we do have clinical researchers and socio-bio researchers that in fact get their MPH and do very well.
Okay, also, we do have graduates who have degrees in health administration, graduate degrees that work in research institutions that are supervising other researchers. So it is an opportunity for somebody that wants to go into management that works at a research institution to get the classes that they need and the knowledge and the skills through the MPA with the health administration certificate, to get those types of necessary competencies in order to be successful and to be recognized on their job for promotion and for advances.
Great. Other questions? We have one right in the front.
I'm graduating next spring. When would I apply for the MPH program?
So the question is, I'm graduating next spring, so spring 15, and you're wondering when you would apply. So my expectation is that the applications for the fall 15 cohorts will open probably this coming summer or fall, and so you could start applying as soon as they open. We have the contact information for those of you who are RSVP'd, so we will automatically let you know when that's an option. Some of you even indicated when you submitted the RSVP that you were interested in 2015. We've already noted that so that we can make sure you know to apply. Other questions? Anyone online? Great. Well, thank you all. We're going to stick around to ask questions. We also have program managers in the back. Alice, can you raise your hand? So everyone, there's Alice in the back if you're interested in the MPA plus health administration. Jesse Nepper's also in the back for the MPH, there to help answer questions for you. Our director for the graduate and professional education programs, Long, is also in the back there to help answer questions. And we have our financial aid advisor, Sugair. Could you let everyone know who you are? Here also to answer questions about financial aid. We will stay here to answer any questions that you have. And for those of you who are here in residence, feel free to eat more food so that we don't leave anything to waste. Thank you all. Have a good evening.